Good evening, everyone. I hope you can see me and hear me okay. We'll just give it a little minute or two for everyone to get in from the lobby. So just bear with us for a second. Your video and audio are being sort of turned off as you come in. So it is just me talking. Basically, it's just to minimize distractions, but also because these things are recorded for viewing later. So if this is your first time, you will hopefully see along the bottom of your screen a little chat box. And if you click on the chat box, you can send me little messages. So these will come up publicly unless you choose to send them to me specifically. I will work my way through as many of the questions as possible, and hopefully we'll have an informative evening. So, are we nearly there with the lobby? I think we are.
Yeah, we're all clear.
Lovely. Okay, so thank you very much. For those of you who have not been to one of these before, my name is Jo Southall. I am an independent occupational therapist. I also live with hypermobile EDS, POTS, and a load of other mildly inconvenient stuff. I've been doing these for a while now, but if it's your first time, keep an eye on the chat. You can pop your questions in there. I'm happy to answer questions on anything related to self-management, understanding your symptoms, mobility aids, work, home, anything you're struggling really. So just chuck them all in the chat. If I can't answer something because it's outside of my experience, my scope, my remit, whatever, I will do my best to signpost you on to other services, or I'll let you know where you can maybe go for further advice. So yeah, pop a little message in the chat if you've got any questions, or if you want to just engage with the conversation a little bit. We don't have any pre-asked questions this time, so I will dive right in with the questions from the chat box. So, any advice for increased joint laxity during menstruation? I suffer from PCOS and having my first period for over a year. I feel like jelly and I'm struggling with mobility. Oh, the hormones. The hormones are an absolute pain in the butt when it comes to hypermobility stuff. So, for those who maybe are less familiar with this process, there is a hormone called relaxin, and relaxin levels change throughout your menstrual cycle. So they tend to correlate with progesterone levels changing. And it tends to be that immediately before a period and for the first little bit of a period, relaxin levels are at their absolute highest. Relaxin does exactly what it sounds like it does, and it causes your ligaments to become more lax. Now, high relaxin levels, super handy if you're attempting to give birth, because it stops you from breaking your pelvis. If you're not attempting to give birth and you just want to walk to the corner shop to buy a Terry's chocolate orange, as an example, then it becomes a bit more of a problem. Yeah. So what a lot of people find is that just before a period, some people find mid-cycle as well, that they are going to get increased joint pain, they're going to get increased laxity, which means you're much more prone to injuries. You may also find that because of fluid retention around that part of your menstrual cycle, you get a bit more swelling on your joints and you can feel a bit more achy. Just a little bit kind of, off, like there's more pressure in your joints. So unfortunately, there isn't a massive amount we can do to totally get rid of your hormonal cycle besides medicating you. In terms of your contraception options, some of the benefits around hormonal contraception may be that if you have a particularly chaotic cycle, you are able to regulate it better. So you at least know when you're due a period and can plan accordingly. As an example, if you know you're going to feel rough in 3 days' time, make sure you're not planning to go food shopping and lifting heavy bags in 3 days' time. Make sure you have not decided on the spot to hoover your entire downstairs of your house or something. So it may be that actually, if you find this is a particularly severe problem for you, trying to work out when, bendy week, thank you, Link Fairy, where your menstrual cycle is, you can plan accordingly by adjusting your activities to take into account the fact that you're probably going to feel pants and will injure yourself pretty much constantly doing everyday tasks. So It sucks. It does. Some of the problems around joint laxity we can sort of look at managing separately. So, as an example, if you find your proprioception, your body awareness, your ability to work out where your own arms and legs are, is particularly rubbish during this time, you may find compression garments are really, really useful. So, compression garments give you that kind of extra sensory feedback, and it allows your body to work out where it actually is and what it's up to, so that when you attempt to do a movement, you're more likely to completely successfully, get through that movement rather than injure yourself in the process. Compression can be really useful for that kind of thing, but also around joint swelling. So if you feel like there's a lot of pressure and a lot of pain on your joints, the compression stuff can be really useful for pain management in that way as well. Some people, particularly those of us with POTS, find that abdominal compression can be useful, but obviously with PCOS or with certain times of your menstrual cycle, abdominal compression probably isn't going to feel fantastic. So you may find that like thigh-high compression stockings, as an example, rather than compression tights or compression leggings, offer you that little bit of support, but without squishing anything that you don't want squished. Pain-wise as well, you may find that something like a TENS machine, as an example, could be useful for pain management. There are now devices on the market sold specifically for menstrual pain that are basically just TENS machines, but obviously they come in pink because everything period related has to be pink. A regular old standard TENS machine will do the job. I find TENS machines particularly good for back and hip pain. Excuse me. Especially the kind of pain where it doesn't really matter what you do, it's just a constant level of unpleasant. So TENS can be a really nice way to kind of just get on with that. And it's also quite a nice wearable solution. TENS can also be used in combination with medications. So your paracetamol, your ibuprofen, some of the stronger stuff if you've got that on prescription, as an example. So TENS basically works on pain gateway theory. And the theory is that your body can only deal with so much sensory input at once. And your body prioritizes some kinds of sensory input over the other. So the kind of chronic pain sensory background rubbish can effectively be drowned out with other sensations. And this is the same way that that magic rub works if you've got a kid that's injured themselves. The rubbing sensation kind of literally overrides pain. So what we're looking to do is to override back pain, menstrual pain, whatever, with TENS. And TENS for most people kind of feels like tingly. And tingly for a lot of people is a vast improvement over whatever else kind of pain is going on. So TENS would be a good one to look into. The other thing from a mobility perspective is that it's totally okay and is in fact very sensible to have mobility aids that differ throughout different symptoms that you go through. So best case scenario, I like to recommend people have a range of mobility aids. You may find that at certain times of the month or certain times of the year, you use totally different mobility aids to what you do at other points. So, as an example, a lot of people in summer will use like mobility aids that allow them to sit down more often to cope with being heat intolerant. Whereas in the winter, you may not need that, but you may need something that helps you feel a bit more stable on slippery ground. If you feel like you have turned to jelly for whatever hormonal chaos is going on inside your body, having a stick or a crutch, wheelchair, mobility scooter, whatever you've got, just to give you that little bit of added confidence that you're not going to end up in a heap and to actively prevent you from ending up in a heap on the floor, mobility aids are a really sensible thing to try. I sort of hope that answers your question, but if you do have follow-up ones about that, please do pop them in the chat and I will get round to them as quickly as I can. Okay, lovely. Let's have a little scroll through. Any suggestions for managing joint pain due to a hypermobile jaw? I already have a mouth guard for nighttime twitching. Oh, jaw pain. This is the bane of many people's lives, at times, mine included. So the temporomandibular joint, which is basically the fancy name for this bit, it's a difficult area to manage in terms of, dislocations, subluxations, repetitive strain type feelings. TMJ dysfunction is basically just laxity and ineffective movement around that joint. So there are a couple of kind of fairly intensive, complicated surgical procedures that can be done at the extreme ends of this. Generally speaking, the outcomes for hypermobile patients will be sketchy at best. So we tend to look at more conservative management stuff. So part of this will be pain management. If you find that you are particularly prone to that kind of tension, that clenching, you may find that there's a correlation between how bad that is and how stressed you are during the day. Stress is one of those things that takes any symptom and just escalates it to the next level of unpleasant. So stress management is a really, really important part of coping with a chronic illness of any kind, because we just don't tolerate stress well. So if you are carrying stress from your day, from your work week with you when you go into bed, that's probably not going to be a particularly good contribution to getting a good night's sleep without that kind of clenching mouth pain type situation. You may find that some relaxation is a useful thing to try. So guided relaxations can be a really, really good way to kind of fall asleep in a nice, relaxed manner. You may find that kind of breath work, breathing exercises during the day are a really useful way for you to get rid of that tension just periodically as you go through your day. As often as possible, take a little minute to yourself and just get rid of as much extra tension as you can. TENS is also something you can use for jaw pain. So you can get TENS electrodes that are designed specifically to go on your face. I learned this, I had dental surgery a couple of years ago and it did not go particularly well. And I spent the best part of a month with a TENS machine stuck to my face. And it was the only thing that got me through that. The TENS electrodes typically will have one of two kinds of connector. So if you've got a TENS machine, it's basically like a little box with a set of dials on it, and it just gives you electric shocks. If you have a look at the connector for the leads you've got, you'll either have a kind that looks like a popper or a kind that's a metal pin that pushes into kind of a like tube bit on the other side. So as long as you match like the right kind of connector to your electrodes, generally speaking, they're interchangeable. So if you've got a TENS machine and a set of cables already, have a look at like facial TENS electrodes and just match the type of connector you have. Generally speaking, they're probably about the size of your thumbnail. They're just like quite little round electrodes rather than the regular square ones that are sort of, I don't know, that big, that kind of size. These are really, really quite tiny. So have a go, see if that makes a big difference. Some people with TENS will get something called carryover, which is basically if it works well for you while it's running, some people will get an equal amount of time after they turn it off where they continue to get pain relief. This is particularly useful for falling asleep if you've got a lot of pain. So run your TENS machine for a little bit while you're in that carryover phase, fall asleep. So that might be a way to go. If you haven't discussed this with your doctor or your dentist, it's definitely worth having a word with them. The other thing you can maybe give a go with is kinesiology tape. So kinesiology tape, if you Google for tutorials, there are some out there that are done by physios or taping specialists. And it's basically just a little bit of tape that comes down from as high up in your hairline as you can get down, and then it splits, and one will go around your jaw and one will go slightly more forwards that way. And what this can do is just help with that sensory input to make sure that you are like aligning your jaw normally, that you are holding your face in a nice relaxed position. And it can also help a little bit with pain management. So hopefully some or all of those will be useful. And yeah, you get some relief from that because it's a rough situation. Okie dokie. I was recently diagnosed with HSD in POTS, but have been struggling for a while. In terms of mobility aids, is it best to use them to prevent symptoms or to only use them when I'm actively in pain? My main issue currently is fatigue and my hips and knees aren't very stable. So there are two kind of separate schools of thought here. There's the first one is that if you've got a symptom and you need to be able to go places and do stuff, using a mobility aid is very sensible. It allows you to function, to go off, to do things without being dependent on your ability to walk consistently and confidently. The flip side of that is actually if I need to go and do something and I know doing it, in the last 10 times I've tried it, I've had a fatigue flare in 9 of them. In that case, using a mobility aid proactively is also very sensible. The difficulty here, and I think the thing that a lot of like medical professionals tend to be a little bit concerned about is, what if you decondition or you lose fitness because of it? So yeah, deconditioning is a concern. It's something we should be aware of. If you don't move, if you don't kind of do things on a regular basis, your muscles will weaken. Your body will not cope so well with existing, as it were. But using mobility aids for fatigue management may mean that you then have spare energy to use for things like, I don't know, physiotherapy at a later date. So if you are saving yourself a bit of time doing the physiotherapy type stuff, what you may find is that, walking is not necessarily an effective use of your energy. It's not the best exercise out there. Pilates, swimming, something like that might be better. So if you were to use mobility aids to replace that long kind of slog that is walking, you may have more energy to put towards actual dedicated rehab. So that's the kind of approach I like to take with people, where actually use mobility aids to prevent your symptoms, use them to avoid risk, use them to make your life easier. But the overall aim should be so that you can put that energy towards something else. And ideally, the something else would be kind of getting fitter. Now, I'm not saying you have to just, if you want to use a walking stick for 20 minutes a day, you have to join a gym. But what we don't want is to kind of supplement mobility aids in and then not replace that energy expenditure with anything else. So the overall aim is to keep people moving. But a very sensible way to keep moving is to avoid injury and to avoid horrendous pain flares. So actually mobility aids can be really, really useful for that. One thing I will say, there's a lot of stigma around mobility aids, as an example. Some people feel like as a wheelchair user, you kind of, unless you can't walk, you can't use a wheelchair, or if you're in a wheelchair, you can't get out of it. It's all a load of rubbish. It's all just social stereotypes that have no basis in fact or medical science or anything. So have a think about what you need, what your body copes well with, what your body benefits from, and do that. Because the person with the most experience here is you. You're the one living in this situation. If you feel like you going from A to B is not an effective use of your energy, if it's too hard, if it feels like it shouldn't be this difficult, pop an aid in there, see what happens. Because I definitely think mobility aids have a real part to play in reducing that kind of fatigue stuff and giving us some quality of life back so that we can go out and do some more things. The other thing that may be worth looking into is splints and braces. So along with mobility aids, splinting can be a really useful thing to do, particularly with regards to hyperextension. So if there are joints where you are especially prone to injury, as an example, you may find that splints and braces help to prevent injuries enough that that pain and inflammation calms down. And then you can do a little bit of physiotherapy, build a bit of muscle strength, get some stability back using your own body. But step one in rehab is always to prevent you from doing more damage. So having a think about splinting and bracing, if you feel like there are situations where that might be right for you. If you're in the UK, you can request a referral to orthotics and your GP can send you to have splints and braces assessment. The NHS fits and provides them. You don't need to buy them yourself. I would very much encourage people to always go via orthotics for 2 reasons. The first of which is that decent braces are an eye-watering amount of money. My last pair of knee braces from orthotics were £600 each. My orthotist didn't bat an eyelid at that, whereas I was horrified. So splints and braces, make use of the NHS. The services are there for a reason. The other reason is that fit is really, really important for these things. So if you have a brace or a splint that does not fit well, you can potentially cause yourself some damage by wearing that. So having a proper assessment, getting it fitted, making sure that it works for you is an essential part of getting the best out of that aid effectively. If you've ordered via orthotics and whatever they've ordered turns out to not meet your needs or to not fit well, they'll just order something else. And it saves you from having to go through the hassle of like dealing with returns and all that kind of stuff. So yeah, hopefully that makes a difference. It's also worth considering in terms of pain management. There are different kinds of pain. The kind of pain that results from twisted ankles, as an example, would be, that's an acute injury. That kind of pain is absolutely manageable, whereas the kind of chronic pain that isn't linked to damage, that kind of is sometimes treated in different ways. So working out what's actually going on with your body is an important step as to working out how you deal with that in real world situations. Okie dokie. I have had increased pain in my hip and SI joints, and it's making sitting upright difficult. Okay. So SI joint instability, that's a difficult one. So your sacroiliac joints are the base of your spine, where spine basically turns into pelvis and everything kind of slots together like a little jigsaw puzzle. In a completely working normal human anatomy, that's not supposed to be a moving joint. It's supposed to be basically just held in place by like fibrous tissue, like it's supposed to be fixed. That's not really how it works for a lot of hypermobile people. Mine certainly isn't fixed. Instability with that can cause a whole range of symptoms, the worst of which for a lot of people is pain. You also get some kind of sciatica, referred pain. You can get some nerve issues. You can get circulatory incontinence issues. You can get all kinds of kind of muscle spasms and other unpleasant things. The difficulty with sacroiliac joints in regards to things like splinting and bracing is that it's quite difficult to splint something that's effectively the top of your pelvis. Anatomically, a lot of us will find that that's our widest point or thereabouts. So if it's your widest point and you've got a brace wrapped around it, the minute you sit down, that just rides up or wanders off from where it's supposed to be, and you lose that support. There is one brace I've come, well, two, in terms of splinting and bracing, like SI joint dysfunction. If you can stabilize that joint with bracing, you're probably going to see a drastic improvement in your pain. So the first one is the Sacrofix, and it's basically a pair of lycra hot pants with Velcro tabs on them. And the SI belt goes round the hot pants and Velcros to the sides. So it doesn't ride up when you sit down or when you lean over or when you're walking around. Again, it's not cheap, so I would recommend going via orthotics because that's just going to be your best option. The other option is something like custom-made compression garments. So compression can be really, really useful. There are a couple of companies that make compression like lycra suit type things. DMO and Jobskin are the main ones used in the UK. These are typically kind of custom designed to fit your measurements and like where you carry your weight, where you carry your muscle, your kind of skeletal anatomy, that kind of thing. So having something like that would give you a high degree of stability in a really kind of customized fit. I would also definitely say speak to physiotherapy about that, because I think it's something that like really, really building your butt muscles and your pelvic stability can be really beneficial there. The final thing I would say is TENS. Again, TENS is fantastic pain relief for SI joint dysfunction. So if you haven't tried a TENS machine out, please give it a go, because I think it would possibly really, really help. The other thing to think about is your basically the angle your body's at. So a lot of people will find that sitting at right angles is quite uncomfortable. So if you've got your back, the back of your thighs, and then your knees would be down here. You may find if you adjust that angle a little bit to bring your knees up, it creates a little bit more stability with your pelvis and your lower core muscles, and you find yourself feeling a bit more stable, and it can help with like reducing pain there. So you may find a wedge cushion is a useful thing to look into. And those are basically just cushions that are a couple of inches on one end and they taper down to a point on the other. And they can be used to basically go on top of any existing surface, chair, wheelchair, car, whatever. And then it basically just brings your knees up, but whilst still providing support across the entirety of the back of your thighs. So you're not kind of shifting all of your weight straight onto your SI joints. But yeah, hopefully that some of that is helpful. Okay. Okay, so follow-up one on the menstrual cycle issues, managing hyperextension. Yeah, so like the pain and hyperextension stuff, I definitely think compression garments are going to be useful. TENS machine for pain relief. Likewise, having a think about what activities you're doing and seeing if you can take more breaks, seeing if you can reduce the weight that you're having to lift. If you, as an example, are getting something heavy out of the oven, do you have to have that on one baking tray, or can you chop whatever it is in half and have it on 2 small baking trays? So looking at ways to protect your joints while you're working, and then compression to improve your body awareness and to deal with the fluid retention as well would be my best advice there. Another example here, so want to know more about managing hyperextension. That's like kind of a big question. The first and foremost way of managing hyperextension is to be really, really body aware, to pay attention to what your body's doing and to keep your muscles engaged. But obviously that's not a particularly easy process. It does take a lot of time and a lot of work. Compression clothing can be really useful. So it's you know, something to have a look into. But you know, it is a bit of a challenge in terms of like, you know, other particular joints, that kind of thing that might be useful to know, so I can give you a bit more of a detailed answer. But if you're not working with a physiotherapist already, I would say get one. I would try compression clothing, and kinesiology tape is a good one as well for improving that kind of overall body awareness. But yeah, that's quite a big question to look into there. Okay. Okay. Having a bit of nightmare. The cushions and props I usually use to cope with my SI joint dysfunction are now making my knees sublux / dislocate. I usually have a. Oh, I really wish it wouldn't do this. Screen jumps around. I usually have a wedge under back and a bolster under the knee. Tried lower cushion under the knees or side sleeping with cushion between the knees, but the knee is still dislocating on a hair trigger at the moment. Any other ideas? So longer term, I would take that to a physiotherapist, get yourself some exercises, get some stability improvement. Short term, there are there's such a thing as a sleep system. I'm kind of hesitant to recommend this because it's an absolute palaver getting an assessment for one of them. But you can get kind of positioning cushions that are basically slightly more, it's basically like a W shape. So your knees are kind of in the dip bit of the W, and they're a little bit more supported. You may find that is useful. But I would definitely, I think physiotherapy should be involved. And I think building some muscle is going to be your best bet. Short term, you may find that it's like tubie grip, just putting on a little bit of light compression is useful, gives your body that extra awareness as to what it's actually up to. And what it might start to do is kind of give you that little bit of advanced warning that you've got your knees at weird angles, and you can kind of preempt the subluxation by noticing in advance. The other thing I would say is take a picture of how you normally sleep and look at that picture and see if your knees are at really weird angles or if there's something bizarre going on with your positioning. Those of us with poor body awareness can often think we're doing something in a very nice, normal, relaxed, neutral position, but actually we're really not. And it's because we've tangled ourselves up in weird shapes, or we're laying wonky or something, you may find that's part of the problem. But because poor body awareness, particularly when pain is involved, may not have noticed that actually, like, there's a really simple fix, and it's just to move your knee 2 inches to the side or something. So I would definitely say, like, have a photograph or 2 of how you normally sleep, see a physiotherapist, try a bit of tuber grip. It is a difficult one. You may find that in the short term, while you're working with a physio, you do need to brace your knees while you sleep, just because you're going to keep doing constant damage with the constant cycle of dislocations. So if you can keep them, in one place while you sleep, at least minimize the damage. It's not like you're exercising while you're asleep anyway. So it may be that splinting is a good way to go about minimizing the amount of damage you're doing now, and then hopefully when you see physio, or when you kind of get some further support with that, you'll be able to work on something a bit more permanent solution wise. I just see a reply to that pop up. Yeah, physio waiting lists are quite a long one, unfortunately. So fingers crossed that comes through quickly. Right, let's go back up to where we were. Sorry, bear with me as I scroll through all of the messages. Is there anything to help increased pain in fingers and hands as it gets colder? I suspect I have Raynaud's, where the fingers go white and purple. Also having to wash hands in cold water, which is not helping, as the tap just feels like it's burning my sensitive skin. Okay, so Raynaud's can be a really common complication of autonomic dysfunction. So any kind of like POTS or syncope type disorders, Raynaud's is quite a common thing. What it basically is, in the form of secondary Raynaud's, is that your blood vessels clamp shut inappropriately in response to what your body thinks is like life-threatening chill. So this is part of the reason why, as an example, if you are a mountaineer and you're trapped up a mountain somewhere, you tend to get frostbite on your fingers and toes. It's because your body protects your core temperature by cutting off circulation to your extremities. And that's a sensible thing because it keeps you alive. But at the same time, from a Raynaud's perspective, getting a bag of frozen chips out of the freezer isn't actually a life or death situation. So there's really no need for my body to react the way it does. One of the things that is often talked about in terms of managing Raynaud's is avoiding sudden temperature changes, which is a big challenge in winter, where you've got warm house, cold outside, where you've got cold items to pick up, where you've got cold water versus hot water. What I would say is, if you're washing your hands in cold water, okay, could it be lukewarm water? Take that little bit of extra time to just take the chill off ever so slightly. Gloves are a good thing to try, compression gloves in particular. There are quite a lot of brands out there. I'm particularly fond of Chronically Colourful because they do tie-dye compression gloves. So that's always a really kind of nice thing to try. But compression gloves basically help by retaining warmth, and they can also be really useful for managing the kind of achy joint pains you get when your hands are cold as well. So that's a particularly nice thing to try. Wrist warmers as well. So keeping your circulation warm before it even gets to your hands. Any kind of like wrist or hand warmers are going to be sensible. In terms of your management stuff, it is worth, if you are on POTS medication, discussing this with a GP. So POTS medication, like beta blockers, so your propranolol type medications, work by basically reducing your circulation to your extremities. So if you have Raynaud's as a pre-existing condition and you are put on a beta blocker, your Raynaud's is probably going to get worse. I must admit, this is still an ongoing development thing in terms of me finding solutions for it. One thing I did find that was quite nice last year was Tiger Balm. So there are quite a lot of kind of warming feelings generated by the ingredients in tiger balm, but they also have a slight anesthetic feeling. So particularly if you've got that kind of burning pain when your hands start warming up, or if you get chilblains, as an example, that kind of thing can be really, really helpful with tiger balm. So that one's always worth a try. You can, if things get super desperate, get USB heated gloves that run off battery packs you keep in your pocket. So if you are like super desperate, if you're really, really struggling with cold hands, USB heated gloves are excellent. They're a really, really nice thing to try. You can run them off the same kind of battery pack you use for like phone charging type stuff. So yeah, USB heated clothing is an increasing thing. My dad, in fact, has a USB heated like jacket body warmer, which is just amazing. But he mainly uses that because he wants to play golf at stupid o'clock in the morning. But like it's a very, very cool piece of kit. So that kind of thing can be brilliant for those of us who are naff at regulating our own temperatures. I just saw a question pop up. Tiger balm. It was tiger balm red I was using. So yeah, I think that's the way to go. But there's no harm in trying some of the others. But that's the only one I've ever used. So yeah. The other things in terms of supplements for things like that. So a nutritionist friend of mine recommended ginkgo as a supplement to improve your circulation. There's also a chemical called bromelain, I think you pronounce it, that's found in pineapple that works as a vasodilator. So if your digestive system tolerates pineapple, it's recommended by one of the like Reynolds organizations as being a thing you can try to improve your circulation. So yeah, tropical cocktails and gloves, I guess, would be the way to go about that, and a little bit of tiger balm on the side. I hope that's useful. Okay. Okay, any advice for protecting wrist joints? Oh, it stopped scrolling around again. I've looked into splinting, but I'm overwhelmed by the mixed messaging. This is why like NHS orthotics is going to be the way to go. Wrist joints, we tend to do something called activity splinting. So it's not a case of going, I have hypermobile joints, so I'll wear wrist braces. Because what happens then is you end up wearing them all the time and your body gets really, really lazy and you end up dependent on those braces to keep your hands attached to your arms. However, there are situations where splinting is very sensible. So I have hypermobile wrists and I need to lift this saucepan full of boiling water is an excellent situation in which wrist braces are a really good idea. Because the risk is not only will you get a wrist injury, but you're also going to end up with burns and you ruin dinner. So that's like, it's part of a risk assessment process where what you're looking at is what's the risk of this activity if I don't wear a splint. If there's a high risk of injury, splinting might be a more sensible option. Whereas if there's a low risk of injury and there's a low risk that it's going to be causing you a problem longer term, then maybe you don't need the wrist braces for that specific task. There are going to be different kinds out there. Some of them will be much more restrictive than others. Some of them have like plastic or metal kind of stays, so they completely immobilize your wrist, whereas others offer a little bit of support, but you'll still have full range of motion. It very much depends on your degree of wrist instability, how much pain you're in, what kind of tasks you're doing. I have 3 pairs of wrist braces, all for different things. Because I found that's the best way to allow me to do a really, really wide range of tasks, but safely. The vast majority of the time, I don't wear any of them. But when I do need them, I've got the option. So part of it is going to be trying to work out which tasks are the problem here. And then what range of motion do you need for that task? If it's lifting something heavy, but you don't need to be able to move your wrists very much, then you can go for something really, really restrictive with loads of metal and Velcro that will completely immobilize things. If, however, it's a task where you need a little bit of a proprioceptive boost and a little bit of support, but you do still need a good range of motion, arts and crafts are a good example here. You don't want something that's quite so restrictive because it's going to stop you from doing the task. So a little bit of a complicated process. Getting some support with that is a perfectly reasonable thing to ask for, whether it's via orthotics or via hand therapy, both of whom can deal with wrist splinting. But yeah, hopefully that helps a little bit. Just think about what you want to achieve and what the risks are. And if you find that the risks are unreasonable, then it's time for a wrist brace. Okay. Hi, is memory retention linked to hypermobility plus speech development delay and pronunciation linked to small jaw and chewing, things like tough meat? Long-term memory good, but short-term not so good. Hope that makes sense. Okay. So sort of / not necessarily. It's a complicated one to answer. So in terms of memory, there's nothing kind of that I'm aware of structurally that makes hypermobile people bad at remembering stuff. However, being in pain, being fatigued, being distracted by the 9,000 medical tasks you need to do on a weekly basis, all of these things can contribute to what we call brain fog, which is basically just a collection of symptoms that make us naff at cognitive tasks. Brain fog can make memory a real problem. It can give you difficulty with remembering words, with understanding verbal commands, with coping with instructions or patterns or like problem solving. As an example, on a good day, I run my own business and I'm doing a master's degree. So I consider myself to be cognitively, I'm doing okay, right? On a bad day, and this is an example I used and was declined jury duty after they heard this, I once spent a full minute trying to open a bowl with a tin opener because I knew that bowl, soup, and tin opener combined in some way, but I couldn't work out how to operate that process. So brain fog can have a really quite significant detrimental impact on your cognitive functioning across the board. It's not specifically like I'm hypermobile, so I have brain fog, but hypermobility causing pain, fatigue, autonomic dysfunction can then cause brain fog, which can cause issues with all of those things. I hope that makes a little bit of sense. Other classic examples may be things like forgetting how my microwave works, or putting lettuce in the dishwasher rather than back in the fridge, that kind of thing. Brain fog can be a real kind of issue for that. In terms of the jaw and the physical pronunciation of things, temporomandibular joint dysfunction can have an impact here. It may be hypermobility linked. That doesn't mean hypermobility explains the whole issue. It doesn't mean hypermobility is to blame at all. It is perfectly possible for you to have a bendy issue and a separate standalone other issue as well. But all too often there is a bit of an overlap there. So speech and language therapists are going to be the experts in that area. They're really, really good at building up kind of skills for physical pronunciation, and to build like the things your body needs to be able to do that task in terms of dexterity and muscle control and all that kind of stuff. So in short, it might be related, but also it might not. And I hope that was at least a little bit useful. But yeah, it's not a particularly easy thing to puzzle out. Okay, let's have a little look. As per usual, the chat has moved to weird places the second I looked away from it. Okay. Okay, I've got something called epididymitis. I'm probably almost certainly pronouncing that wrong. Oh, chat, stay still. Swelling inside my bits for a male. The GP has no idea how. Having ruled out all of the normal causes, could HSD cause swelling down there? It's not visible, so it's internal swelling. I'm awaiting my ultrasound appointment. It's not a symptom that I have heard of being classically attributed to hypermobility. However, about 6 months into my career working with bendy people, I decided that I would never ever draw a line on things that are certainly not bendy related, because the amount of weird complications hypermobile people have had is mind-boggling. It may be that you have a separate standalone medical condition that interacts badly with the hypermobility. Likewise, hypermobility can cause all kinds of weird urogenital issues, particularly things like urinary retention, as an example, or incontinence. So it may be that it is possibly related. It may be that you've got a separate issue, but it doesn't play well with the hypermobility. Having issues with connective tissue can predispose you to issues with all kinds of other weird stuff as well. So yeah, it's difficult to kind of know whether it's going to be related. Hopefully the ultrasound leads to some kind of diagnosis. When you've got a diagnosis, you can have a little search to see if it is related or not. Generally speaking, treatment tends to be the same regardless for whatever kind of weird issues we've come up with. The HMSA does have some information about bladder issues, so it may be that some of that is linked. It's all in a vaguely similar area. But yeah, that sounds like the sort of thing that a urogenital specialist needs to look into. And hopefully you'll get some ideas from the ultrasound. But yeah, I'm sorry, I can't be any more use than that. It's not something I've come across before. Okay. Right. Is dyslexia and dyspraxia linked to hypermobility? As I suspect my daughter may have dyslexia as well. So there is a new and emerging whole range of exciting research into neurodiversity and hypermobility from the wonderful Dr. Jessica Eccles, who did a talk for the HMSA yesterday. Is it yesterday? But yeah, so in short, there is all kinds of emerging stuff that indicates that vaguely learning developmental type things can be slightly more hypermobility linked than we thought. But that doesn't mean there necessarily is a link for everyone. And it doesn't mean that everyone who has hypermobility is going to be dyslexic, as an example. The dyspraxia stuff is a much more definitive link. So a lot of the dyspraxia symptoms are also symptoms of hypermobility disorders. So what can happen is that when a child presents as being clumsy, accident prone, not particularly liking ball sports, and being disorganized, the thought process is this child has dyspraxia. But actually, those things could also all be true for a hypermobile child with brain fog. So there is quite a considerable overlap, and the dividing line between who gets what diagnosis tends to be based around the severity of each kind of symptom. So if the coordination issues are more prevalent, you'll get a child that's diagnosed with dyspraxia. If the kind of pain and injury issues are more prevalent, you may get a child that's diagnosed with hypermobility. It is very, very, very difficult to put neat little boxes around those two separate diagnoses because there is so much overlap and so much similarity in presentation. So effectively, yeah, we don't know. This is why I very much like being an occupational therapist rather than a medical professional. So as an OT specifically, I don't have to work all of that out, right? What I can do is go, based on these symptoms, here are the approaches we're going to take to see if we can improve function. Whereas from a medical perspective, doctors like nice, neat little boxes, and they like to be able to go, these 5 things are caused by this diagnosis, and these 10 things are caused by that diagnosis. Sometimes you can't do that. And the best way to go about managing all of this is to look at what an individual is struggling with, specifically that one person. What is it that we can help them with? And then look at solutions for those key problems. And if you focus on the person rather than all of those diagnostic boxes, it often gets an awful lot easier to work out what's helping, what isn't, and what's a waste of time. So yeah, I think labels absolutely have their place and they're very useful at times, but you can wear yourself out trying to work out where these nice neat little boxes are around all of these symptoms, because for most of us it's just a combination of things that result in a little bit of chaos, and we try to manage as best we can. So I hope that's sort of helpful. Best of luck with the puzzling things out journey. Okay. Lovely. I would love to know if there is such a thing as a twisting rib with joint hypermobility. Often feels when I bend over or cough, it feels like a cramp or an organ slipping and I have to stay bent over. I can't move till it slips back into place. This is under my right boob in my rib cage. I also have very... Oh, stop scrolling around. I've lost it. Very... sorry, the chat thing drives me to distraction. I also have very large breasts, which cause me a lot of strain on my back and shoulder joints and shoulder girdle and rib cage. It's getting worse as I get older and gain weight. What are the implications of larger breasts and joint hypermobility? Kind thanks. So you can indeed have ribs that wander out of place, very much like the sacroiliac joint that we discussed earlier. Ribs are kind of supposed to just be fixed where they belong, with a little bit of stretch in there so that when you take a deep breath, your rib cage expands, and when you exhale, it contracts. That's how it's supposed to work. But the thing that holds all of that complicated mess of ribs together is connective tissue. And if you have rubbish connective tissue, your ribs can be slightly less attached than they should be. So yes, you can subluxate ribs. The symptoms are often unpleasant stabbing pain, sudden inability to take a deep breath, loud swearing also tends to have a correlation effect. If you are a little bustier on top, you may find that that weight distribution predisposes you to having rib issues because you've got that combination of being kind of off center, like body mass, like weight wise, as well as having that laxity and that lack of muscle tone. The absolute best thing you can do is build as much upper back and shoulder stability as possible. However, that won't necessarily absolutely fix everything. So in terms of managing symptoms, you may find that certain types of bras are great, other types not so much. As an example, I need a really well-fitting bra. I'm quite top heavy as well, but long line bras will ruin my rib cage for weeks. I can't tolerate them at all. So working out the best way to kind of manage your boobs effectively, but also building a lot of back and shoulder stability. Any kind of Pilates based exercises tend to be really, really good because they work specifically on getting different bits of your body to work together. And what you want is for your back, your kind of chest, your shoulder, your core muscles to all work really well and really naturally together so that you can support your entire body. Obviously, that's a longer term process. It's not going to make a difference overnight. So pain management is going to be a bit of an issue. Things like TENS can be really, really useful. Compression can also be useful. Some people find that compression tops work wonders, or sports bras. I know a few people who wear like kind of binders as well to just help manage that kind of pain. It is very, very mixed in terms of results with compression. Some people think it's fantastic, other people think not so much. Kinesiology tape can also be used for back and rib pain. If you are seeing a physiotherapist, you can ask them about getting taped up. I have had physios in the past who are happy to like teach a family member how to like tape me so that I can get that ongoing support without having to have weekly physio, which does work. In terms of the exercise side of things, the wonderful Jeannie de Bon is an excellent resource there for, you know, all kinds of rib, chest, upper back stability. What else can I say about that? In terms of, you know, the implications for, you know, bigger boobs, weight gain, that kind of thing, longer term, that we don't really have research into that. The exercise recommendation, Jeannie de Bon, who runs the Zebra Club. So if you search Zebra Club, that comes up. Jeannie is also intermittently, you know, popping up on social media, sharing different resources and things. So it's definitely worth checking out her social media. Yeah, we don't really have like comprehensive research on what happens to people above a certain cup size longer term down. It's not really how it works. You may find that, you know, you need regular bra fittings, you need extra support. I had some discussions with people around breast reduction surgery. The difficulty with that is that all surgery carries inherent risk. And for hypermobile people, it carries more risk because we tend to not heal so well. We tend to recover slower. We tend to have more bleeding, more bruising, worse surgical outcomes in general. So I think you would struggle to find somebody willing to do any kind of breast reduction surgery, as an example, on a hypermobile person, unless things were really quite dire. There are surgical options for wiring ribs in place. Again, they are last-ditch solutions, and I would only consider that if you've completely exhausted all other options and you're still having major issues. I definitely think corsetry and like back bracing as well should be something that's considered before you look down the kind of surgical route. So a really well-fitted corset can offer an excellent range of support. It also, you know, gives that kind of rib stability, and, you know, overbust corsets would be particularly good support for larger breasts. So if you are going to go down that route, there are some resources available about medical corsetry. There's a lady called Lucy. Lucy's Corsetry is a resource to look up. She's done quite a lot of kind of work around supporting people with medical corsetry, and I think rib subluxation is a perfectly reasonable kind of thing to look into for that. So hopefully some of that is useful, but definitely Jeannie de Bond's resources, a TENS machine and some kinesiology tape would be a really good starting point. Okay. Ooh. Yeah, lots of people talking about the Raynaud's and stuff there as well. Okay, best type of knee brace for preventing hyperextension. Very much depends on the size and shape of you and your knees, on your range of motion, on what you want to wear that brace for. There's a big difference between something that, as an example, completely blocks hyperextension by locking your leg straight versus the kind of cage brace, which is what I would typically see people wearing, that blocks hyperextension but allows you full range of normal movement. The downside to that is that an awful lot of those are very, very expensive. You know, I mentioned before, mine were like 600 quid each. So from that respect, knee bracing is definitely something that orthotics should be involved in. There are some really amazing braces out there that are brilliant for blocking hyperextension, but the price tag is the issue for almost all of them. So hinged knee braces tend to be what I would recommend for that. Equally, the DMO compression garments can be really, really good for preventing hyperextension, because you can get basically like a cross built in as a reinforcement across the back of the knee to really, really discourage you from hyperextending. So there's a couple of options there, but all of them really should be done with an orthotist, I think. Okay. Oh, we're out of time. Oh my goodness. Okay. Any advice for dealing with chronic fatigue, which is moderate, possible ME? I have to have a nap by early afternoon, even when hardly do anything. I tried to pace, but it's not helping. And the odd occasion, I do go to the local shops with mobility aids, just a simple taxi ride, and going into one shop and I'm exhausted. Okay. So my first and foremost thing is get to your GP, have blood tests done, specifically to check for things like vitamin D deficiency, vitamin B deficiency, and anemia. All too often, chronically ill people are brushed off with, like, it's just your normal fatigue, good luck. But it turns out it's normal fatigue plus anemia or plus vitamin D deficiency, all of which can really exacerbate how rubbish you are feeling. Pacing is always my advice for fatigue management. However, there's a lot more to pacing than just taking more breaks. So I've done a couple of really nice podcast recordings with a lady called Natasha Lipman. These podcast recordings give away all of my trade secrets for pacing and fatigue management. Sometimes it's simpler things like taking regular breaks. Sometimes it's more complicated things like actually tuning into what your body's feeling like, it's really not an issue I can cover in a few minutes. So I would definitely have a look at the Rest Room podcast with Natasha Lippman. Specifically, I think the video is called something like Pacing for People Who'd Rather Be Doing Something Else. But if you look on the Rest Room podcast, I've talked quite a lot about pacing there. And hopefully that will, give you a good overview of some of the pacing strategies. I do still offer pacing masterclasses because I just genuinely, it is the thing that I think is most important for fatigue management. But yes, definitely double check with your GP there. Equally, there's a thing called pacing by numbers, which is about pacing with your heart rate. So this can be particularly effective for people with autonomic dysfunction, but it's about basically kind of limiting how hard you push your body into that tachycardia energy envelope thing. And the theory is that if you can stay within the kind of safe heart rate range, you're not going to be pushing yourself into a fatigue crash at a later date. So there is some information about that available online as well. But yeah, pacing by numbers might be a good thing to look up. It just, for those who struggle with pacing, it's very, very frustrating when your smartwatch yells at you constantly for going up the stairs or walking to the loo. But if you can start to work out like what's going on in terms of your heart rate, as an example, which tends to be a common fatigue contributor, it may be that that's a useful way to start kind of working out what your tolerance is for different things. Okay, I'm not going to get through all of these questions. There are quite a lot of questions. There was just one very simple one here, which I will very quickly answer, and that was about what the difference is between like 600 quid braces versus something like the Neo G strap-on ones. It's not a silly question at all. So my £600 knee braces were made of carbon fiber, and they were waterproof to the point where I could go like in the sea with them on and they wouldn't have any damage at all. They were like an open design, so I went surfing in them, I've been rock climbing in them, they go in the swimming pool, and they are basically indestructible. It's a much firmer block on hyperextension, so it is physically impossible for me to hyperextend my knees whilst wearing them. But they don't have that full compression thing. So it's literally about blocking hyperextension and sideways movement rather than about limiting kind of by compression, if that makes sense. So basically, I would also expect them to last quite a lot longer. So I've had them for maybe 7 years at this point, and they're still in pretty much immaculate condition, bar a few scratches from when I was climbing trees. So yeah, it's a bit of a different beast, as it were, in terms of like the level of support and what the brace itself will handle. So I hope that was helpful. Myself and the wonderful social media / events / professional coordinating team who are here tonight will record all of the questions that I didn't get round to. And I'll start with those at the next session. That is just me. Some sessions aren't just me, in which case we start fresh from there. Okay, hopefully that's all useful. Thank you all very much for coming. As always, it's been an absolute pleasure answering your questions. If anyone wants to get in touch with me, I think my details from my website are already in the bottom. If you've got follow-up questions, do feel free to ask. And if you have a question you would like to ask next time, please do feel free to message me or the Hypermobility Syndromes Association, and we will make sure you're on the list. Yeah, the only other thing to say is that the event date has slipped my brain because I'm tired, but I am running one of these specifically for healthcare professionals with the wonderful Dr. Philip Bull coming up soon. So if any of you have got physios or GPs or OTs or anyone else in your medical group who would like to learn more about hypermobility syndromes, they've got their own live stream coming up and they should check the events section of the website. But yeah, that's it. I hope you all have a wonderful evening and I will see you all next month. Bye. Wednesday, 22nd. Nice.